Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Malia. She's a spayed female Chow-Lab cross, beautiful color, magnificent looking dog. If you watch her breathe, she's actually struggling to breathe. She wheezes, especially when she's excited, and that's what the owners are concerned about. It's hard to hear on this recording, but this is why. This x-ray was taken elsewhere, but it looks like there's some kind of foreign body in her trachea, in her windpipe. So she was brought to us for bronchoscopy. We're going to run a scope down into her trachea and see what that is. So here is her snout. We're trying to show that this is the same dog. Now we're inside of her trachea going down, and we see this cauliflower-like object. As we get closer, the dog's breathing, so it's moving in and out. But this is a tumor growing from the side of the trachea. So I rotate the camera around to get the orientation better, top to bottom. We have a snare. We're going to run down the scope and see if we can snare this thing. We also have a diode laser set up. If we can't get this tumor inside the snare, or the snare would break or fail to cut the tumor off, then we could try to evaporate it, debulk it with the diode laser fiber, which would go down the scope. So we've got that fired up and ready to go. And here's our snare exiting from the bronchoscope. And we're going to see if we could possibly remove this. We biopsied it first, sent the biopsies off, but Malia's having such a difficult time breathing that she's not going to wait for the report to come back. So the next day we go in to debulk this tumor and remove it as much as we can to give her some relief. So Dr. Stephanie has deployed this snare now, and I'm going to try to guide this scope. I've got to turn it over to the side, get it more eccentric to try to grasp the base of this tumor. That looks pretty good right there. Maybe, no, it slipped off. So we'll try again. That looks good. Now we're getting it down to the base, holding it, holding it, holding it, pulling it closer, tighter. Oh, the snare is sliding up on the tumor. So it looks like the snare could possibly work. We're just going to have to keep trying to get it oriented to catch that tumor in the snare so we can cut it off at the base. We're going to try again. These videos are highly edited, a lot more raw footage than you actually see in the edited final version. Got the snare around the tumor, look at that, right at the base, coming toward us. Now the scope gets closer and we lose visual, but we're pulling the scope out to see if we, oh, look at, there it is. Yes, yes, yes. We removed it with the scope. And so we've accomplished just what we set out to do. We wanted to cut this off at its base and remove it. We were afraid it might just fall down into the lungs. We'd have to go fishing for it to get it out, or the dog may cough it up. We weren't sure what would happen, but we cut it off and removed it with the scope, and there it is, big as life. We did run the scope back in to evaluate bleeding. It was minimal. Here is the tumor compared to the size of a nickel. We administered anti-inflammatory drugs prior to surgery intravenously to decrease post-surgical swelling in her throat, and we put Malia in an oxygen-rich environment with her hindquarters elevated after surgery, and we've administered oral anti-inflammatory drugs, which will go home with her. Here she is the next day, doing great. Malia, you can breathe a lot easier, and so can we. The tumor turned out to be a chondroma, a benign cartilaginous tumor that does not appear to be fast growing, so it's possible this may solve this problem for the rest of Malia's life, and certainly for the foreseeable future. Columbus Small Animal Hospital, loving our work.